Good morning to all you beautiful people looking for a different perspective. I am Dr. Patrick Flynn. I am so glad that you are with me here this beautiful Saturday morning. It's Memorial Day weekend, isn't it? It's going to be quite an incredible weekend up here with the weather. It's supposed to be so amazing. We're supposed to hit even 80s in Wisconsin, which is absolutely incredible to be outside during the time and everything. So thank you very much, so much for joining us on this wonderful Saturday morning. We have so much to cover. And before we get started, I just want to say thank you for all the people that were at our talk in Iron Mountain, Michigan. It's kind of nice. Iron Mountain is only really about an hour and a half, hour and 45 minutes from here, but it's also closer to my hometown. Got to see people that I grew up with. Got to see people where a lot of people do not know this, but my first initial practice, practicing, because I didn't own a practice, I was actually in somebody else's office for a couple months, was actually in Upper Michigan. Was in Escanaba, Michigan, not too far from Iron Mountain, and it was kind of neat because I got to see some of the original people that are, there's still patients down here in Green Bay, but when I was up in Michigan after I graduated, I couldn't get my Wisconsin license right away, so I was in Escanaba, and there were some patients that I started with there that are still with us today. It was neat seeing them, and it was neat to actually having them up there and kind of reminiscing how they're like, Doc, I remember the first time you started. So it's always kind of neat reminiscing those great things that we have going on. So yeah, so thank you for all you guys that were there in Iron Mountain. You guys were a blast. Thank you for all the friends that showed up. Thank you for all the people that showed up. Thank you, Dr. Thomas and Laura and Karina and Dr. Ryan and all of you guys putting on, and all the team putting on a wonderful event. It's getting close to the end on that. So it was great to be around the area to have one of our last talks. That being said, don't forget to go to our website, thewellnessway.com. As you can see, we're always doing our journey theme this year. It's been kind of great because just as we talk about all the health conditions coming on, guess what happens? The journeys that you're on, you can watch the show on adp.thewellnessway.com. That's where most of you guys are on right now. Plus, we're also live on other venues as we continue to be let back on the internet for at least a time before I say something that upset somebody and gets me kicked off, but that's kind of neat. But that being said, we still have a little bit more that we're doing. A lot of people say, Doc, the breast cancer series has been great so far. Where can we watch it? Well, remember, go to YouTube. We still have my Dr. Patrick Flynn DC page on YouTube, and then we also have the Wellness Way YouTube page. Please go and see there. Just to let you know, had a meeting, some intense meetings with our team. We have incredible people behind the scenes, from all of our video editors to our writers to everybody. And we have a lot more incredible, not only short clips coming out, but long material that won't be presented on this show. Because we're going to put more information for you guys to make better choices, to give you a different perspective, and you're always going to see things that you're going to be able to implement in your life right away. Everything from food stuff to clinical things. As you know, I will always teach you some of the greatest clinical things on the planet, just like we're going to cover today on a secondary aspect of breast cancer. But it's something to know that we have more videos coming out, and they're going to be up on YouTube. Joshua and I yesterday were just kind of rearranging some things, and so you can see the breast cancer series. I'll have my top picks that will always be out there because I like certain things to get out there, and material that I believe that if you implement right away will be virtually life-changing. Okay. That being said, speaking of life-changing, we are down to a couple events. As you can see, this upcoming Friday, I will be out in Portland. Yes, Tigran, Oregon is actually a suburb of Portland by our office, Beaverton. Over in Portland at the Shawn Garden Dancing Center, we have a beautiful hormone connection seminar. Then the week after that, I will be in Raleigh, North Carolina, again with Dr. Blake and Allie, but before that, I'll be at Portland with Dr. Stephanie Tilden, and I'll be out with Dr. Blake and Allie in Raleigh, North Carolina. And then Friday, June 10th, the last of the Hormone Connection seminars in Pensacola, Florida with Dr. Devin. All the events are filling up and selling out, so please get your tickets now. I think we're almost at max for Portland, and we just have about 6 days before I'm out there. Exciting, because I also, when I'm out there, I get to go to Precision Labs, where you guys will see even today. I love the Dutch test. It's one of the major tests that we do, and especially if you're dealing with breast cancer, you're going to do that. So I get to go out there, hang out at the lab, sit down with their scientists, sit down with the owner of the company, who I know quite well because by far it's one of the best labs in the world. I absolutely love them. It's called the Dutch test. You see that urine metabolism test. That does help. So I get to now go to Portland and see wonderful Dr. Stephanie Tilden, see all of you guys that'll be coming to the hormone seminar. But I also get to go out to the laboratory and actually see all the the facilities, which I've been out there several times, but it's just an amazing facility. They're always expanding. They're always getting bigger because the sad part is this is people need more labs in history because they're sicker than ever, especially with breast cancer. As we're going through that, it's significant. Now, that being said, it allows us to give everybody a different perspective. I can honestly tell you, I love when I created this chart. It gives a perspective on everything you're doing. Everything in life is all about perspective. This deals in healthcare. This deals in relationships. This deals in individuals. You can have people get in massive arguments. Brandon, put it up one more time for me. I want you to take a look. I honestly sit there and travel all over the world and watch people yell if they're staying on the right side of that room, and they sit there and scream that it's a square. And I have people stand on the left side of the room and look at the wall and scream it's a circle. And they will sit there and yell at each other from across the room. Everything from this is this, this. We've seen this what happened over the last 2 years in with the whole healthcare thing. But I see this in everything. And sometimes it's good to have an outside perspective, okay? And go, guess what? It's a cylinder. You know what I'm saying? It's a big old tube in the room. Stop yelling at each other. But what they do is they're looking at that, and it's so real in so many ways that people are going to always have a different perspective. And I'm cool with it. I'm cool with that, guess what? That you can see a square. I'm cool that you can see a circle. But sometimes you got to step back and go, it's almost like in life. You know what I'm saying? I can honestly tell you, I'm not old, but I'm also not in my 20s either anymore. And I can honestly tell you, I always tell these young docs and things, I'm like, man, chill out a little bit. Relax, you say, enjoy life. It goes by so fast. I can remember the day that Faith and Trinity and Calista were born, and now Faith's in college, and my 8-year-old just finished up school yesterday and is going to be entering another grade. Enjoy life, everybody. Trust me. It's something that I really want you to understand. It's like, it's tough enough. So ideas I tell people, life is actually really good. Sit back, especially this Memorial Weekend, and look at what these people in the military were actually supposed to sit back and reflect what some people have done. There's some people that fought for our country and did some amazing things. So if someone doesn't get their Starbucks or their food the way it is, and I watch people literally freak out, I'm like, it's a perspective I cannot understand. I can't and stuff. But the idea is this, is sit back, reflect, understand how great, especially if you do live in the United States, you've got it extremely well, no matter what side of the aisle you're on. So it's a perspective I have when I watch people and that thing screaming at each other. It's a circle, it's a square. Trust me, it's all about perspective. And with that being said, it's kind of neat. There's something that I had one of my students bring up to me recently. And a lot of people do not know that we have something called the Wellness Way Academy. I just took a screenshot of part of our website, so it's not really our full website. I just took a little screenshot of it so people say, hey, but we have something called the Wellness Way Academy because I've had healthcare professionals, I've had individuals, I've had stay-at-home moms, I've had people in the financial world, I've had people in all walks of life go, Doc, you teach this stuff at extremely high level to the point where I sometimes know more than my doctor does. And it's true. It really is. And what do I mean by that? Because it's going to sound interesting. I'm going to talk about, I actually got an email from somebody watching our breast cancer series. And this is very common. When you look at the perspective that medicine has when it comes to breast cancer or any healthcare realm, I want to show you something quite interesting. Is you got to think of it this way. They're going to sit there and argue and scream about their perspective. Say, listen, it's a square. And then you have the other radio saying, well, it's a circle. Well, I'm like I said, so I'm sitting back going, you know something? I'm going to look at both of them and go, okay, both you guys have a little bit of rightness, but it's not the full story. And then I want to show them the cylinder and say, listen, you're coming for this angle, you're coming for this angle, it looks this way. So what happened is, I had an idea about 7 years ago where I said, listen, I believe I could teach anybody anything. I really do, when it comes to this stuff. Because no one, it's going to sound funny, this is not a joke, guys, I'll make this very clear. Nobody taught me what the majority of the Wellness Way actually practices today. I didn't get it from my school, I didn't get it from my undergraduate, I didn't get it from my graduate schools, I didn't get it from my postgraduate schools. I had to put a lot of this stuff together, and then I got clinical results that were absolutely incredible. And that's why people say, Doc, the Wellness Way started out in Green Bay a long time ago, and now it's everywhere. Well, it's everywhere because it brought a perspective, and then the perspective changed into the results that people were looking for, and that's the key. I always tell people, I love the term a different perspective, but a different perspective only changes your thinking, and it has you look at things differently, and then it gives you the action steps and the way to do things. And just like I'm going to cover when it comes to breast cancer today, that listen, there's different avenues you can take. Well, believe it or not, it sounds funny. When I started practice, It didn't exist. So I had to sit there and piece things together. And of course, now you guys see this some years later. So then when I realized, what if I piece it together for individuals that are passionate about healthcare, that are passionate about seeing a change? And that's what the Academy started out about. And I can honestly tell you, we've had people that had no formal education and can still get the same clinical results I get. And no joke. And we've had people from nurses and doctors and pediatricians and pharmacists and NPs and everybody from every healthcare profession go through our academy to really become the best at what is out there today when it comes to healthcare, which is our approach, which I'm very proud of. So I said, you can check out our academy. It's just thewellnesswayacademy.com. It's basically a 1-year training schooling that people get to go to actually do these things that we do here today. And so go check it out. It's quite incredible. Our team, our next class, I think, starts tomorrow. But we have a quarterly class that starts every 3 months. And we really put an intense aspect from Dr. Zach, Dr. Mitch, Nicole, and several other teachers on there that really do an amazing job. It's all online, too. You can start it. You can actually sit at 10 o'clock at night every single night and train. And it's quite an incredible venue that we put together. And it took us a long time to put it together. But imagine one of the greatest educational tools to actually understand everything that we do and actually practice it someday. So, yes, here we go. We are going to now move into the third part, well, my third teaching. First of all, I want to thank Nicole for doing a wonderful job of teaching just cancer in general last week. But I want to start with our breast cancer series again, because there's so many things out there when it comes to a perspective that I want people to know. And that's why we've been setting the series up. We're probably going to have, as I continue to go through and I write the material and put it together, I'm like, yeah, we'll probably do it for 3 or 4 weeks that way. Now we're probably going to do it for 3 or 4 weeks more to continue, because there's so much information that we have out there that we need to get there. And as you guys continue to send your questions in and more after watching it, it actually realizes that we need to add more stuff to understand. Because I want to show you some things I did get this past week from people that are a little bit misleading, and it actually confuses people. So I want to make some comments on them before we go forward, before we step to the next stage. And here it is. People say, Doc, I hear it all the time. I heard it from David Wolf. I hear it from natural practitioners. I read their articles and they say, good versus bad estrogens. What is your opinion? Okay, I'm going to give you a very different perspective on this, and let me just be bluntly, and then I believe that I will be able to make a case for what I have to say. Let me say that again. Do you know that what happens is a lot of times I say some things that are very blunt, and sometimes you don't like them, but I'm like, no, listen, I'm always going to explain why this is not rationally a thought process for me. Because if you look, good estrogens versus bad estrogens. Well, my first thought when it comes to estrogens is, once again, what are they used for? Are they needed by the body? For example, do we need a xenoestrogen that comes from the outside? No. Okay, but they're not talking about good versus bad when it comes to like an outside, like a soy or something like that, or something that comes from a chemical that can mimic estrogens. No, we're talking good versus bad, the ones that are in our body that are produced or metabolized. So for example, if you actually look at the group of estrogens and you go, okay, listen, like I talked about last week or a couple weeks ago, 4-hydroxyestrone can be very bad in damaging the DNA of the tissue if it's elevated. Well, it doesn't mean it's a bad estrogen. It means the reaction of it, if the estrogen is too elevated, it can cause a problem. Like, for example, they demonize estradiol. Ladies, you can't go from a young lady. Faith and Trinity could not go from a young lady to a woman without a significant increase of estradiol and make those levels normal. But if estradiol gets to an excessive level, so let's say the range, goes from 70 to 110, and Faith, when she's 30 years old, her levels go to 175 and then maintain there. There's going to be some health problems. There could be endometriosis, there could be fibroids, there could actually even be breast cancer. It doesn't mean that that's a bad estrogen, because being at an elevated level, like if all of a sudden I got Ziva in this cup and all of a sudden I go, all right, I pour some Ziva in, I'm drinking it, and I'm like, okay, nourishing for my body and stuff of this, and all of a sudden I just grab a Ziva and I keep pouring, it keeps overflowing. And it makes a huge mess everywhere, and there's stuff, and the water runs out, Ziva runs on the floor, it gets all sticky and everything like that. It isn't bad Zevia now. It's still Zevia. It really is. It's just that it's just excessive and it's making a huge mess. All right? Well, guess what happens? You start to get levels of 4-hydroxy or even estrone or estradiol or estriol. If they get too elevated, it's a mess. It's not good or bad. It's just that, once again, why did these levels go elevated? It's a perspective of going, all right, give you an example. I've said this before. If you have a tub and it has, let's say, 6 drains and 2 of them get plugged, it might try to go down the other drains, the other 4 that are, at least open, but the tub could actually fill up and overflow because of the amount of water coming in compared to melon water comes out at a certain timing. But it's not, the water isn't bad, even though the water actually went all over the floor and caused damage, and it even could rot out the floor if it's a hardwood floor, mess up the tiles, or go into the walls and cause mold. Yes, I get it, but it's not bad water. You understand? It's not bad Zevia. It isn't good or bad because they're needed. Actually, every one of the hormones that people say are bad, if they are gone from the body, that's a bad day. That's a bad day. As they suppress estrogens, most of their production or their conversion with an aromatase-inhibiting medication, it's a bad day. That's why they say there's negative side effects from it, because if the tissues that need estrogen on a daily basis do not get it, just because you're so worried about the breast tissue, but then all of a sudden the heart, the liver, the bone, the hair, the skin does not get the estrogens needed, it's like having a car that has no fuel. It's a bad day. It cannot run. So this concept of good and bad estrogens. So when I hear people say good and bad estrogens, I'm going to be very direct. I just don't believe anything they say beyond that. I'm sitting there going, you're misleading. On top of it, you're going to look at going, okay, how to get rid of these bad estrogens? I don't even understand what that means. So it's a perspective I want you guys to get that way. Okay, number 2, there's a very popular website kind of defining things, and they're sitting there going, okay, what is estrogen? All right, cool. So far it's a hormone health network. What is endocrinology? I'm looking at the first part of the website and I go, all right, I actually looks pretty good. Pictures, gives just a graphic of estrogen, and all of a sudden they give some explanations here. Estrogen is one of 2 main sex hormones that women have. That right there, I'm going, estrogen is one of 2 main sex hormones that women have. Well, estrogen is a general term. Estrogen is a term that represents a group of hormones. So estrogen is not one of 2 main sex. I know what they're trying to say, but once again, when you're talking to the public, you've got to be very clear. Otherwise, it's misleading. I actually just started teaching this all over the world, going, estrogen is not a hormone. And they go, and remember, because I put a blunt statement out there, now let me explain. Estrogen is a term, or estrogens is a term that represents a group of hormones. Then people go, that makes sense. So when you see estrogen as one of 2 major sex hormones that women have, and I know what you're saying, they're trying to say estrogen and progesterone, but progesterone itself is an individualized hormone. Progesterone is a term, and if you look at hormone charts or you look at labs, you can see progesterone. You can see it right there. And here's the level it's supposed to be. You cannot look at a lab. You cannot look at a graph that actually shows the patterns of hormones, especially in a cyclic woman or even a menopausal woman, and see estrogen. You don't, because you have to individualize all those hormones and take it away from the group, like estradiol or like estrone, and then put them on a graph that way and show things to go. So when they do this, I'm like going, it's kind of misleading. The other one is progesterone. Estrogen is responsible for female physical features and reproduction. Men have estrogen too, but small amounts. Okay, I agree with that. Estrogen helps bring about the physical changes and turns a girl into a woman. The time is called puberty. These changes include breast changes, pubic changes, menstrual cycles. Estrogens help control the menstrual cycle and is important for childbearing. Estrogens also have function to keeps cholesterol in control. Protects bone health for women and men, affects your brain, mood, bones, heart, skin, and other tissues. I agree with that. But it doesn't really keep cholesterol in control. All right, I want to go back over that. Because you need estrogens itself are a steroid-based hormone. They're sterols. That means you need cholesterol to produce estrogens. What does that mean? That means all of a sudden, if a woman actually goes through her period during the first 5 to 7 days, and then her estrogen starts to skyrocket, believe it or not, your liver is going to put out a lot more cholesterol in order to produce those hormones so it can get the mitochondria, you can produce that. So it keeps cholesterol in control. I don't really know what that means by that, but the idea is this. And actually, because you know why? Because all of a sudden, if you need more hormone, your cholesterol is going to skyrocket because you need that in order to work. Now, next part of this thing, I was going, okay, how does estrogen work as I'm looking at this? Ovaries, which produce a woman's eggs, are the main source of estrogen for your body. I can agree with that. Your adrenals are located at the top of the kidney, make small amounts of the hormone. I agree with that. So does fat tissue. Once again, I like this. Now they got this stuff right. Estrogens move through the blood and act anywhere in your body. What can go wrong with estrogens? For many reasons, your body can make too little or too much estrogen. Okay, stop right there. Stop right there. Once again, a little bit misleading, okay? It doesn't make too little or make too much. You have to get a little bit more in detail so people understand, especially you ladies. If all of a sudden we see that estrogen levels are low, even in cyclic, you gotta understand, you have to look at the ovary itself. Ovary produces a certain amount. It actually produces a majority of it that way. Your adrenals produce some. Your fat tissue produces some. It's why you'll notice that women that are very skinny or work out excessively can actually reduce their hormone levels because they lose some of their fat tissue. That's why if you look, fat tissue changes through the month with a woman. They add fat, they pull it away. Your breast tissue gets larger, your breast tissue gets smaller, your hips change. It's like, ladies, I know it's kind of interesting, but I always find it kind of funny that as the month goes on, you're frustrated that sometimes your jeans are tight and sometimes they're loose. That's called being a cyclic woman, because your body will put fat tissue on the face, thighs, and breast during certain times of the month, and it'll take it away during certain times. And that's why you see the changes in your body. That's understandable. But the idea is this. If you look at like a loss of hormone, there's actually factors that cause that. Because if all of a sudden your ovaries don't actually have enough brain hormone, and guess what happens? It doesn't stimulate enough. And on top of it, most of your excessive hormones can only really come from either a tumor or it's not converting. So remember that, because you can have tumors that produce too much hormone. You can actually have that happen with fat tissue, so you can have too much fat tissue. But the idea is this, there is actually more of an issue. Your body's not purposely making it, it's actually problems that are going on. All right, here we go. Do you or you can make too much or too little estrogen, such that birth control pills and estrogen replacement therapy? You might have to keep track of your symptoms, changes you feel, write them down each day, bring in the symptoms journal to your doctor. Your body makes 3 main types of estrogen. So it went from 2 major sex hormones to now it makes 3 types. Estradiol, the most common type of women, childbearing ages, let's say cyclic. Estriol, which is, once again, the main estrogen during pregnancy. That drives me nuts that they talk about that so much. Number 3, estrone E1, the only estrogen your body makes after menopause when menstruation periods stop. Okay, there is some very misleading and actually things that lead to why the medical field has a perspective of really only testing estrone during the menopausal years. Because that, once again, estrone, I can honestly tell you, by far is not the biggest contributor to breast cancer in women in the menopausal years. And the majority of breast cancer that women have come from ages when you're in menopause, not when you're cyclic. Yes, you do get breast cancer when you're cyclic. That happens. I literally talked to a woman when I was in Iron Mountain who actually was pregnant and got breast cancer. Literally, I talked to her this past Tuesday up in Iron Mountain, and we helped her through the process as she was going through. She went through multiple, both medical and our treatments through the process. But what happens is she was cyclic and she was pregnant. See, and that's why when we look at estrone, once again, estrone is a very common one to be a problem, but it's not the major hormone that's going to contribute to breast cancer when you're menopausal. That's why when they test the estrone, they're always like, I don't know why E1 is so low, considering the fact that you actually have breast cancer, but we're going to get into that. But so some of these things, once again, it leads women confused. It leads them as they're looking for things on what to do. So that leads to the email that I got this past week. And let's take a look. Dr. Flynn, Dr. Patrick, I have really enjoyed your first 2 breast cancer videos. They get me to think so differently, and it's plain to see on the labs, and it has helped me discuss things with my doctor. I am going through breast cancer treatments, and they don't seem to have many answers when I ask questions. They just keep telling me it does not matter. It's all about treatment. My question is, how can I keep my estrogens, I love that you put an S on there, good without so much fear of estrogens, because they tell me they need to lower them or it will come back. I asked them, don't I need estrogen for other parts of my body? And they said, yes, but we have to keep your estradiol as low as possible or it will come back. I would like to hear your feedback and what can I discuss with them about my estrogens to help keep them, but not be afraid of future reoccurrences. Thank you, Cindy. Wow. I read that, I was like, whew, this woman has definitely not only had a different perspective, but she's getting stuff into detail. And once again, I don't know her. She's going through, treatments right now, so she probably ended up with breast cancer. She's going through medical treatments there, but she's starting to think of going, okay, they've talked about discussing. They're probably going to give her a aromatase inhibitor for at least 5 to 10 years, if not longer. And they talk about this way, okay, we got to drive your estrogens down. Okay, once again, why are they elevated and all those things? And then once again, she asks, what can I do to actually have, not fear estrogens because they're needed for other tissues, but actually not be afraid of their major reoccurrence? Wonderful, wonderful question. I'm hoping to get into that a little bit more detail today as we go through this. So let's dig deep a little bit into some things that I think are so key for not only breast cancer, but it doesn't matter what condition it is. Because if you look at endometriosis, and if you look at fibroids, if you look at PCOS, it's all the same hormones. Now, it doesn't mean that they're all at the same amount, or once again, there's things, but I would say this. If we look at some of the things that we need to do when it comes to estrogen-dominant conditions like those, or even testosterone-dominant conditions, here is the thing that I think that we need to know when it comes to reoccurrences of breast cancer. Because here's what happens. If you take the formal aspect of what they want you to do when you go through breast cancer, they're going to try to suppress all the estrogens. That's why they give you some either hormone blockers, or they give you an aromatase inhibitor, or they give you some kinase blockers, all trying to reduce its production. And remember that, trying to reduce its production. But you know what happens? Here we go. The reason why people will talk about good and bad estrogens is because the effect it has on tissues. And there's forms that are weaker, and there's forms that don't affect the breast tissue as much. And so therefore, if you want to go through our theme today, let's talk about something a little bit more bold. Conversions to the weakest form is one of the major keys that I want her to look at, for Cindy to look at when it comes to reoccurrences. Now, conversions, all right? Now, I want to give this term synonymously with another word. It's actually called metabolism. Now, let me kind of go through this. If we look at metabolism, no, remember, just sit back for a second and close your eyes. Do me a favor on this, because I just want you to clear your head, and I want to know what pops into your head when I say this word. All right, here we go. When I say the word metabolism, what do you think of? See, most people are going to think weight loss. I got to have a good metabolism because I got to keep myself skinny. Well, what does that mean? What does metabolism mean? Well, if you look, you're converting a fat-soluble molecule to a non-toxic eliminating form. And it's usually water or a toxin to get out and put in our urine or our stool, and we dump it out. So you convert it. Now, why would you have to convert things from one form to another? Two things. If you have estradiol, which is extremely potent, it's actually the strongest estrogen for development. That's why when a young lady goes from pre-pubescent to puberty, estradiol changes everything. They develop breasts, they develop hips, they develop pubic hair. It actually changes every tissue of the body that has an estrogen receptor. It matures at a very high level. Obviously, as estradiol gets out of control, you're right. As the things actually are produced at such a high level, they can actually now do what? They have some breast cancer. But here's the point I want to kind of go over this way, is it's very potent, and therefore, if it's not converted to a weaker form, and let's say estradiol was now just dumped into the intestinal tract to get rid of, that's why if you notice, a very common cancer with breast cancer is actually intestinal cancer. Why? Because if your body tries to dump it in the intestinal tract, it'll just grow those cells. And you end up with what? Intestinal cancer and growths that are there and all those things. So that's why it needs to convert to its weakest forms. Because the weakest forms sometimes don't even affect the breast tissue. We're just talking mainly about the breast tissue because we're on breast cancer series. But it's still, the weak forms have great effects on other parts of the body, which means they still can do their job with the skin, hair, bones, and maybe even the liver, but not, once again, an overstimulation. Because that's what a hormone is. It's a messenger to stimulate some change in the DNA so there can be more production of certain cells. So therefore, it can go to certain cells that are extremely important. So it's all about conversions. You've heard me talk about this forever. Because if you do look, and this is the confusing part and why I will always have a different perspective when it comes to hormones, is the fact that they convert. Every hormone's not produced. You understand that I do agree with some of the things. If you look at estradiol and estrone, E1 and E2, those are the main hormones produced. That means they actually come from the organ, come from the tissue itself. The rest are converted. That means they take this fat soluble molecule, change it into a different soluble molecule. It metabolizes, it converts. See, so that's why if you look at adipose tissue. So ladies, let's think about this. Do you understand, ladies? Through those cyclic months, you have different metabolism. You do. And so there's times you don't want to eat sugar, and there's times that you do. So if you look at those times, now I want you to take this, ladies. Let's take something funny, but it's true. And women laugh about this when I teach at the hormone seminar, but then they sit back and scratch their head and go, Doc, that's a pretty good way of thinking of it. Yes, it's a perspective that nobody teaches you. All right, let's go through just a funny one. All right, I'm going to go through a funny one. It's part of the hormone seminar, and I don't bring this out publicly, but it's how I teach a little bit. I tell women to always get rid of their scale. Why get rid of their scale? Because here's what. Women get very frustrated and very sad as they're trying to change things. And unlike a male can have very consistent things where if they drop sugar off, that they just lose a ton of weight. They do. And it frustrates women. Doc, my husband stopped soda for a week and he dropped 10 pounds. I stopped soda and nothing happened. I even gained some weight. Yes, because your body's dramatically different, especially your cyclic. Now, menopausal women, whole different story. They can kind of get away with that. But I want you to picture this, ladies. As your estrogens fluctuate, you're going to need some tissue to grow because there's going to be higher levels during certain times of the month that they're not. If you look at a cyclic chart over the course of the month, estradiol goes up and down. That means your weight goes up and down. Ladies, this is how I teach you. You'll put on your bra 1 week and you'll get up, it's all nice and full. Next week, you'll actually put it on and your breasts have changed, usually going down smaller. And it's frustrating. You're like, okay, doc, where'd they go? Well, the fat tissue has changed. That's understandably. Now, let me give you a little scenario, ladies. Do you understand that when your estrogen levels start to go up, you are starting to put more fat around the what? The breast, the face, and the thighs, and that's why you put your pants on, you're a little frustrated. That's okay, that's supposed to hurt and happen during time. Those are the times you want to be very careful about consuming things that can help you add more fat because your conversions in your metabolism has changed a little bit. Why? Your body's trying to hold on to some fat to produce higher level of hormones. So remember that. Then there's times that all of a sudden it seems like things change and now they go away that week. And see, women just say, well, doc, I'm less puffy. It's not really being puffy. Even though your face looks a little bit more full, you're not really swollen. You actually produce fat tissue. It actually adds another layer of skin on you. Guess what happens? It gets a little bigger. Your pants get a little tighter. Your bra gets a little tighter. You're not puffy. You're not swollen. It's actually fat, all right? Now, once again, during that time, because your body's converting certain things, you might not be able to metabolize sugar as well because metabolism is, once again, a conversion process. So that being said, there's things that actually help us convert things from one form to another, and that's our enzymes. It really is. It's a conversion process. So if you think about metabolism, always synergistically talk about conversions. Now, that's important because we want to metabolize or convert those estrogens from one form to another. Now, there's a great system in our body. It's called the cytochrome P450 enzymatic processes, and there's a bunch of them. And I want to show you the research behind it because this is one of the most basic things when it comes to hormones. So as we put up the research here, we talk about it. Cytochrome P450 mediated metabolism, there's that word, of estrogens and its regulation in humans. Let's read this. Let's go through this. I'm not going through the whole thing, but there are some key points I would like to point out to you there. Estrogens, see, there we go. It doesn't say estrogen. Estrogens are eliminated from the body by metabolic conversions. Oh, look at the words right there. I love that. Get the understanding of conversions. 2 estrogenically inactive metabolites that are excreted in urine and or feces. Let's come back to me for a second. Do you see what it says? I want to pull this up, okay? Metabolites that are what? That are more estrogenically inactive. That means they have certain properties of estrogen, but they don't sometimes have the high actually production and stimulation that they do at certain forms. So if you look at estradiol, which can be very potent, or look at 4-hydroxyestrone estradiol, which can actually even damage DNA, guess what happens? If those are high level, it's a bad day. So therefore, it can metabolically convert, metabolic conversion to estrogenically inactive metabolites. But those metabolites are estrogens that have a positive effect on all areas of the body. And yes, if there's elevated levels of even the rest of those metabolites, they're bad. Now, it's not a bad estrogen. The effect is bad. So there's no such thing as good estrogens. There's no such thing as bad estrogens. But the idea is this. When you look at these things, if they're not converted into an equal amount of format, and there's ratios of it, like, for example, there's two 2 hydroxyestrone estradiol, and there's 16 hydroxyestrone estradiol. Those things have to be converted. Now, let's go on. The first step in metabolism, there we go. Remember, it's not about fat, it's about converting fat-soluble things to the changes. The first step of metabolism of estrogen in the hydroxylation catalyzed by the cytochrome P450 enzymes. Since most CYP isoforms are abundantly expressed in liver, the metabolism of estrogens mainly occur in the liver. Here we go. Ladies, 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 ladies. Anything that causes a toxic effect to your liver is going to mess up your hormones. Period. Period. You know what I'm saying? Toxic food, vaccines, poison, cortisol, stress. You know what I'm saying? There's so many things. Sugar, fatty liver disease, non-alcoholic, alcoholic. You know, that's why alcohol affects a woman when it comes to hormone balance significantly more than it affects men. Why? Because men's estrogen levels are significantly, dramatically lower than women's, and so therefore the estrogen type of problems that we would have would be less. Now it does affect men, fatty liver disease and even alcoholic that way, but not as dramatic as women. See, when you guys have a problem with your liver, you mess up all these conversion processes. That's why when people say, Doc, you know, I'm eating right and I'm exercising and I'm not losing weight. Yes, you're going to be deficient and you're going to have a problem or interference with these enzymes, and you can't convert things from one form to another, including adipose tissue. You can't convert it to a water soluble to get it out, even though you're eating right and exercising. And on top of it, if you eat the wrong things during certain parts of your cycle, and if you exercise wrong during parts of your cycle, ladies, it's a bad day and the liver's still bad. Yes, I know this sounds so simple, but the medical field, the functional medicine field, the integrative field doesn't understand this and doesn't get this. So they generalize, here's a major supplement for you. Let's do a liver detox, which I don't even understand that word, you know what I'm saying? Because you know why? It's really about restoration of all of these metabolic conversions, you know what I'm saying? And yes, the word detox could be kind of, you know, drawn from that, but you really got to get into detail this, especially when you're dealing with breast cancers. And these things are testable. That's the greatest part that I sat there and going, a long time ago, you know, before Dutch even existed as a lab, there was other labs that did this. And I'm going to show you when they figured a lot of this stuff out. It's going to blow your mind away. Because you sit there going, this has been known for such a long time. And they even lay it out pretty systematically and going, not that difficult. But it's such a different perspective. And so you have all the oncologists and all the doctors screaming, lower your estrogens, and you better take this aromatase, and they're fearing you're doing everything. I'm sitting there going, okay, I get why they're yelling. I get why they're screaming when people start asking questions that we're the experts. All right, fine, have that debate. But then after you're done, you know, telling everybody that you're the experts in breast cancer and stuff like that, I'm going to ask you about the estrogens that contribute to that DNA damage, to that high proliferation and growth. And where's your labs that show me where those are at? And how are we going to restore those estrogens back normal? And what is your plan for conversions and actually metabolically converting the estrogens into maybe more of an inactive metabolite that can actually have less effect on the breast tissue, which can now slow the growth or inhibit the growth? And on top of it, there's no such thing as good and bad estrogens, because there's actually estrogens that are at a normal level that actually protect the breast tissue and actually stop some of the ones, even if they get elevated, from actually causing proliferation. See, that's a whole different perspective, but scientifically so sound that nobody argues that. But when you can't argue the information and you can't attack the information, you have to attack the messenger. But I'm like, let's debate it, okay? So and then you guys have the freedom of choice. See, that's the whole idea. Choice is everything to me. It really is. That woman that's going through breast cancer treatment from the email, I'm not gonna convince her to do anything different, but I will try to convince her to come from a perspective of this, that no matter what you're doing, let's look at those metabolic conversions and see if you are still estrogenically highly active, because then if you even go through successful treatment of oxidizing and damaging those cells and get rid of them, it's coming back. And it's a bad day. I had that conversation with a woman that I know up in Iron Mountain that Dr. Laura and Thomas and them have taken care of. And she got through breast cancer synergistically with having to do some chemotherapy and surgery and stuff like that. Cool, okay? But But then what happened is she worked so tightly with them that there was huge success, and the doctors even kind of blown away, going, "Oh my goodness, how aggressive yours was. It seemed to be doing really well now," and she's not taking the aromatase inhibitors or the estrogen blockers when it comes about from there. All right. So now let's go on. Here we go. As we look, a major metabolite of estradiol is 2-hydroxyestradiol, is mainly catalyzed by there's those pathways in the liver and by C1a in the extrahepatic tissue. However, CYP1B1, which is highly expressed in estrogen target tissues, like in the mammary glands, ovaries, and uterus, specifically catalyze the 4-hydroxylation of estradiol. Now, I'm going to skip through some of this that way because this is a little bit more scientific for you guys that way, but I kind of want to go on a little bit more, and actually we're going to go down to like almost the last 2 sentences. This fact suggests that the regulation of CYP enzymes involved in estrogen metabolism by estrogen itself would be physiologically significant for the homeostasis of estrogens at local organs. Let's stop right there for a second. Boy, if that's not a wellness way discussion point right there, let's read it again. The fact suggests that the regulation of the enzymes involved in estrogen metabolism by estrogens itself would be physiologically significant for the homeostasis of estrogens at the local organs. That means that if you can actually get those things to metabolize properly, it's going to keep all those things in homeostasis balance. So therefore, the tissue gets what it needs, but never gets to the elevated level to cause massive proliferation or any growth of the organ that way. And so therefore, it will help maintain it at a level at each organ system, for the bone, for the breast, to the uterus, to everywhere. Let's go back. In this mini review, we discussed the CYP-mediated metabolism of estrogens and the regulation of estrogen metabolizing CYP enzymes in relation to risk of cancer. Now, it's quite interesting. What they found is if you keep things metabolizing well, your chance of breast cancer is significantly low, which I agree with. I totally agree with this. And if you look at this, we're talking about metabolism. Metabolism. So remember, when you hear that, don't think about fat loss. Think about fat conversion. And guess what? A hormone is a sterol. It's a fat-soluble molecule. So is adipose tissue. So ladies, the reason why I keep on bringing this up is because if you are stuck at weight loss, you say, "Doc, I'm eating good, I'm exercising, I'm stuck," you have a metabolism process problem. So therefore, you have a conversion problem. And where should you dig deep on, ladies? You're right. I can see all these people even in here today. The liver. The liver. That means you might have to cut back on your alcohol and your sugar, and you might need to take some things. But here's what happens. How would you know? That's where you get these things tested. That's why you can actually check on all these different forms of estrogens and progesterones and all your other anabolics that are there. Now, here's significant. This is all the data. And I love the terms that they even use here. Estrogen metabolism and breast cancer, okay? Now, if we take a look at this basic graph, I want you to look at the top right, where there's your estradiol, ladies, if you are cyclic, and then go to the left, you see estrone. And if you look, there's conversions, but look at those arrows coming down. CYP, CYP, CYP. What if I told you that when I was a young kid, all right, Brandon, come back here. We'll come back to this graph in a second. What if I told you when I was a young kid, this is not a joke, this is how it happened. I sat there and went, man, I know how the drugs that they use work on this. And you go, okay, listen, if I'm going to convert testosterone into estradiol or testosterone and estrone, it's going to aromatase. And what happens is this, they go, oh my goodness, there is a aromatase factors that they can produce that now can inhibit it, and that's called aromatase inhibiting medications. And I was sitting there going, how does it work? And I sit there and look it up, and I going, what if I could do that from a different form? And so I started going through all the what they use to manipulate that way. And I started, oh my goodness, they're manipulating the liver this way, and they're manipulating the fat tissue this way. And I started to look and go, not only, once again, is there a reason why it actually is plugging up and ended up elevated that way, what if we could restore those pathways or put them back to normal? And I sat there and I called people. I went through books and I tried to find the constituents that could connect those dots to support it. And I go, oh my goodness, it's not converting from this to this. Let me give you an example. If I want to metabolize A and I want to metabolize it to D, okay, let's do this. Simple. So we're going to go A right here and we're going to go D right here. But you say, Doc, but you got to go to B and you got to go to C. And then C can go to D. You're right, you can't go to A to D directly, all right? Here's what you need to do. You need to go from A to B. There's certain enzymes, aka there's certain things, constituents, you need to convert that. And then if it does, you can get to B. And then if you want to go to B to B to C is different. You have to convert that there, and C to D. So think about those way. Those are those CYP450 enzymes that convert all those things in the liver and other tissues, but mainly the liver. And islets can go, all right, so if all of a sudden A to B goes, now I'm trying to get to D, I'm trying to get to D over here. A to B actually does what? It says, okay, I'm converting, but now all of a sudden we look and B starts to get really elevated. Why? Because B does not have the constituents to convert to C, because maybe you don't eat it, maybe it's not there, maybe you're doing something toxic, maybe you're interfering with the conversion, maybe you're taking the medication, and you go, oh my goodness, now B's getting elevated body, now B at an elevated level is bad. Now, it doesn't mean it's a bad B. It means elevated is bad, but B is still needed. It's just if it gets elevated, it's a bad day. Does it make sense? And see, that's the whole aspect of conversion, of metabolism. So I look and go, I was sitting there going, all right, what if I could actually find the things to give the body sufficiency to go from B to C? And I would run a lab and go, oh my goodness, B's really high, but C's really deficient. And then all of a sudden, I gave the constituents from, yes, more of a natural thing. And all of a sudden, ran a lab again and went, holy crap, it did it. And I was like, I'd call my friends and they'd be like, oh, who cares? I don't know what you're talking about. And I'm like, all right, now remember, I'm in my 20s. I'm sitting there going, okay, cool. Another person came in, ran a lab. Oh my goodness, B was really elevated. Well, let's look at this. Okay, this. Well, they got our factors besides just, and I gave this. All of a sudden, ran a lab. Oh my goodness, it did it again. You understand? I know that it was trial. It was trial like crazy. And it was fun too. And I started to really start mapping those things out. So let's go back to this graph. Let's go back to the graph again. So imagine, medicine manipulates, inhibits. You heard Dr. Nathan Bryan, the scientist that I am very good friends with. They create drugs to try to inhibit and change. And he even does it. He still does it today. And him and I are on the phone all the time talking about these pathways and discussing things. And obviously nitric oxide is one of his big pathways. And you can restore a lot of pathways by nitric oxide and other things that way. And that's where you see some of the things that we do based on your labs. Nobody's the same. That's why it has to be lab-driven, not supplement-driven. That's why it has to be lab-driven, not medication-driven. It has to be based on what's going on with you. Because you may have a different thing of conversion of metabolism that's different per person. So if you look at those conversions, they're going from one form to another. And look at, I kind of laugh. This is just a minor graph based on the research on the estrogen metabolism in breast cancer. And you can just see alone, estradiol, estrone, 2-hydroxy, 16-hydroxy, estriol, 2-methyl, 4-methyl, all these things. See, there's so many estrogens in there converting and changing. And yes, the majority of them happens in the liver. So come back on this one. So that's cool stuff. I geek out on the things. I really do. I like it here going, oh my goodness, and it's kind of neat. And so people wonder what I train doctors on all over the world. People wonder what I actually, what our team does, what the Wellness Way does as a company all over. Man, not only do we have amazing practitioners that work on us, our academy people get trained like this. Because I know right now, I'm teaching you guys. And what if I could teach everybody this stuff? And I think if you're a woman, you need to know this about your body. You really do. Because here's what happens, ladies. Some of you guys have already emailed me going, I have breast cancer, I'm scared. Okay? You don't want to get there. You don't. Because I'm not saying that you get there and you won't need some medical treatment, including chemotherapy, radiation, and surgery. But what if we could make sure, what if we could do everything possibly could to put all of your estrogen levels, your metabolism, your conversions, everything in its best place so your risk is minimal? See, that's the factors that we really need to have the perspective on. And I have never had an oncologist or a doctor, even though well, you can't prevent everything. Well, let me see question. If all these things are more stable and converted and properly and not backed up and not having high levels of 4 and not having too much of this and too much estradiol and levels of conversion there, let me see question. Is your risk reduced dramatically? And they all say yes. They all say yes. They don't say no. But see, it's like this. They try to pick out one scenario and say, well, it doesn't get rid of anything. I'm not saying it gets rid of everything, but with the rate of breast cancer every year continually going up and women are getting scared and scared and you see more pink ribbons and more money given to the wrong perspective, we are in the wrong direction. Could you agree with me on that? See, that's all I'm saying. So having females in my house every day, I'm not going to let them do this. I'm going to make sure that all their conversions and things that they're doing on a regular basis hits that. And every woman I know is going to go through process like this. So they actually have to make the best choices for their body. And every woman is different. Every age group is different. Every woman itself is different due to the factors that there's multiple factors that can disrupt every one of those CYPs. See, that's why it's not everybody takes a supplement. I get so frustrated. Everybody just needs to do cruciferous vegetables and reduce risk of breast cancer. That's not true. If that pathway is normal and you take cruciferous, it doesn't make a damn bit of difference. But if it's deficient and you can test it and you can see it and you can do these things, then maybe doing cruciferous could be life-changing. See, that's the difference. But go back to the graph, Brandon, for me. But see, there's so many of those pathways that you gotta know. And that's what I obsess with. So breast cancer, fibroids, endometriosis, PCOS, all these things, I geek out on it knowing the fact that if we could find so many things that are not converting and not metabolizing and allowing certain estrogen levels to get too high or too low, that we can start to restore that, man, it's going to be a glorious day. So let's come back to this. I want to take a look at something here. Let's take a real lab of somebody, okay? Now, if you take a look at this lab, I want you to go down about a third of the way on the right side of the page, and you're going to see underneath that little gas gauge, it looks like a gas gauge. And to give you an example, the gas gauge, as you can see, is you see 2 stars on the right and left side. That's like a gas gauge. Going below the left one, going above the right one, there's going to be different colors. The green is normal. If you look at yellow, the little arrow, it's low. So let's look at E1, E2, and E3. You can see it right across. If you go about a third of the way down, you see them on the right side that way in that box. You can see E1, estrone, E2, estradiol, and E3. Now, if you look, that's the primary estrogens. E1, E2, E3. So we're going to talk about this. If you look at E1, it's at 22. It's normal. It's in the normal range. You look at E2, it's normal range. It's 4.09. But look at this. Estriol, the weakest form, the form that's going to have the least amount of metabolic activity to actually change breast tissue and other things, it's what? It's at 3.3. That means there is a deficiency. That means there's low, but look at the little arrow between there, the CYP3A4. Okay, come back to me, Brandon, on this one. So I want you to think about this. Now look at this, that P450 cytokine process 3A4. There's an enzyme. Now if you look, going from E2 to E3, actually it's not converting. That's like going from B to C, it's not converting. So there's some deficiencies there that your liver or your intestinal tract doesn't have, because there's 2 areas, but mainly liver doesn't have. And so therefore it can't convert. So now think about this. Now that hormone has to go to different directions. Let's go back to it, Brandon. Now look at this. Now because it's deficient, so it's kind of like that thing, that tub is, that one area is plugged. So therefore, it has to go in different directions. So let's start to go from that estrone down, and you see the green, the red, and the blue arrows. And it's going down the red one, which is 4-hydroxyestrone, which is the biggest contributor to breast damage there is. Come back to me. So think about this. The hormones, the 4-hydroxy is not bad, but now it's at an elevated level, which can now lead to not only DA damage and oxidation, which can now affect the mitochondria, which can now turn that breast into breast cancer, but still not a bad estrogen. It's a bad level because there is a deficiency. There's a problem in this woman's liver, and this is a patient, and she's doing amazing now, but this was also breast cancer. And what happens is this, and they can't convert to the weakest form. So when they talk about, doc, how can I not only protect and keep my estrogens good, and that's about conversions, but you want to make them go to the weakest form, so therefore those weakest form don't affect the breast tissue, because estriol has very minimal effect on the breast tissue, E3. It has a major effect on other organs, and it's quite interesting. And let's take a look at this. Let's take a look at this here. Let's take estriol itself. There's a structure of it. Now watch this. Estriol is less active form of estrogen present in the body. It's secreted by placenta during pregnancy. It skyrockets during pregnancy. The receptors of estriol are mainly located on the vagina, skin, and hair follicles. All right, think about this. Ladies, it's why, once again, during pregnancy, guess what? The vaginal lining can be very good. You know, that's why sometimes women get very turned on during pregnancy. Because you know why? If estriol levels go elevated, like the placenta produces a lot of it, guess what happens, guys? It's a good day, okay? But then second of all, ladies, you hear this all the time, and I love this, they even put in there. It affects the skin and hair follicles. So when I see ladies' skin and their hair not doing well, I'm thinking, man, I want to check on their metabolism. Now remember, I'm not saying fat metabolism. I'm saying their hormone metabolism, so not their adipose, come here, not their adipose metabolism, their fat metabolism, because it is converting a fat soluble hormone. And I'm going, man, their estradiol may be low. Because everybody's like, Doc, do I have to take biotin if my hair's bad? Well, maybe your estradiol is low, and you can take all the biotin you want. I'm not saying biotin isn't needed, but it's not needed for this. But the idea is this. That's why if you ever notice, ladies, I always hear this all the time. Oh, Doc, when I was pregnant, my hair, my skin was awesome. You see this a lot with psoriasis and other skin conditions. When women get pregnant, it disappears. It disappears because their immune system changes and their estradiol changes, and now their skin gets nice and beautiful. You say, I watch women say, Doc, my skin was so beautiful when I was pregnant. My hair was just so full. Yes, I have heard that thousands of times. And some of you ladies are making the dots right now going, holy crap, that's right. But the idea is this. So I see damaged hair and I see vaginal lining problems and and think about this, ladies. If you're hormone deficient during menopause, vaginal dryness is there. And that's why they'll medically and they will give you a form of estradiol synthetically or bioidentical, and it does change the vaginal lining. See, but what happens why is it low? The vaginal dryness isn't there because you lacked some horse hormone. Do you understand? Because that's the way they get the majority of hormone. It's because the metabolism from one form to the other, because estradiol, unless you're pregnant, is a metabolite. It's converted. So let's go back here. The effects of this hormone may be the reasons why skin and hair glow that often when seen in women during pregnancy. It is often found that estradiol has a very little effect on organs like bones, heart, brain, and other crucial sites where estradiol have a great effect. In the human body, estradiol and estrone convert to estradiol, and hence estradiol is considered the most abundant circulating estrogen hormone in the body. Yes, and it's also the weakest form. So when it goes back, what can we do? Let's look at converting to the weakest form. But that happens in certain tissues like the liver and the GI and also in the brain. It's also converted in the brain. And the reason why it's the most circulating one, because it's metabolized and dumped in the urine. That's why it's so easy to measure in the urine. It's very hard to get an accurate level in the blood. It's why when I get interviewed on podcasts and people say, well, Doc, I got some things done. I got some blood work done for my hormones. I'm like, well, you're kind of not really getting a great perspective on this, because blood does not give you 4-hydroxyestrone and all the other ones. It doesn't really give you a good version of what estradiol is. And that's why to truly have your hormones tested properly, you need blood, need urine together. And if anything, I would do both all the time. But then sometimes, if anything, just get the urine done just because you get a perspective of the metabolites, which can really cause some issues. So it's important to see that great difference on there. Now, let's run a little bit. Let's run a little bit on just one of these cytochrome enzymes, the P450, the 3A4. As you saw, that one woman couldn't convert to the weakest form, the estradiol. So the main enzyme, mainly produced by the liver, but other tissues, but mainly GI, and the brain has little conversion. It's going to make sense when I get to the supplement how it works. But let's go into this, and we're going to pull up, I think, is one of the greatest slides. Now, I must warn you, going forward, if you have a tough discussion, let me say this again. Let me step back. I'm going to take a little commercial break. If you are highly offended talking about transgender issues, if you're highly affected and offended by talking about the differences in males and females, you want to stop listening now. Because as the podcast I did in England, they put a warning on, I'm going to be very blunt. And my bluntness is based on basic physiology, biochemistry, anatomy, and how the liver works and how the things work, and I'm going to show this to you. And just because you may get offended because you may know a transgender person that's going through hormone therapy, I'm going to be very direct about some things. So if you're offended, please do me a favor. You're better off not watching the rest of the section, because I'm going to share basic stuff, but you may not want to hear it because I'm going to be very direct on some things. And also too, if you have a very hard time understanding giving your kids medications, things like that, I'm going to talk about some things. And I said, just so you know, I'm giving you a warning to the end of the show. You might want to bug off if you're offended easily. So that being said, let's go forward, okay? But before I do, I wanna take this slide right here. Okay, watch this. Conversions of androgens, your sex hormones, to estrogens in cirrhosis of the liver. Now, this was not actually up there. I put the big lead letters so you could see it. This was researched back in what year? 1975. I was 1 year old. See, the conversion of all these hormones and different things have been known for decades. This is not like this is new. That's why when I was young and I was digging into all the research back in the 90s, it wasn't like this was new. Yes, the clinical things that I practice today, no one really taught me, but the idea is this. But the idea is, hey, doc, where'd you come up with this? It wasn't my research. I just sat there and went, this is basic anatomy. This is basic biochemistry. This is basic physiology. So I pulled out some old PubMed research talking about the endocrine changes that happened back in 1975. They published this stuff. And they even published it earlier. This one was just great as talking about estrogen conversions and testosterone conversions. Okay, so I kind of enjoy that process here. So that's just me. So I want you to really understand that this stuff isn't like this is new. Doc, this new research, really? Hormones, they've known hormone conversions before I was born. You're saying I'm 47 years old. So that's why I kind of find it interesting. I'm going, it doesn't make any sense that when they're like, oh, well, this. Not new. This is basics. This is in every textbook of every biochemical textbook and things in the process, except for their perspective is so dominated medically that medical practice and medical research never matches up. All right? Now, here we go. So I pulled out some medical stuff for you, okay? And I want to show you some things that way. And this is just, you can jump on MedSafe, and it's the New Zealand Medicines and Medical Device Safety Authority. And so I just pulled this up. Now, remember, you can pull up all this information everywhere. They just put this in a nice chart in the key messages, so I want to kind of go over it so we can go over it quite quickly. But each point is well documented, and many other things. You can just take one thing and you go on PubMed and just run on research like crazy on this. Now let's look at the key messages down in the other blue box down there. And here, let's read the first one. So Brandon, after each point, I want you to come back to me on this, but here we go. Now this is just one. This is just one of the enzymes of conversion. If you saw the hormone chart, there was a ton of them. This is just one. This is just the big one. Here we go. Key message. The CYP3A4 is responsible for metabolism of more than 50% of medications. Come back to me. So do you understand that if you start looking up 3A4 CYP, what they'll talk about is they'll talk about massive drug metabolism. That means that guess what? If this, now let's go back to that lab where you saw that woman was deficient in estriol. So the estriol was not converted because the CYP3A4 was deficient. Do you understand, guys, that that woman, if she takes any of those medications that pathway is meant to eliminate, it won't eliminate it, and it will build up in her body, and she can have a major negative side effect because the body can't metabolize that drug, and it just adds that toxin up, and she can be taking a medication that's given by her doctor, prescribed properly, and it could kill her because it actually becomes at a toxic level if it can't eliminate. So I got a question for you, ladies. Got a question for you and your kids, too. Have you been tested to know if you can even metabolize drugs? Do you understand? Man, I have no idea how Charlie Sheen is still alive. I bet you his CYP3A4 pathway is freaking amazing. That guy can drink and stuff, and he's a skinny little sucker, and he actually drugging it like crazy, and he's just still going. I mean, this is the stuff I think about. I'm sitting there going, no joke. I think that the show 2.5 Men is freaking hilarious. And I sit there and go, this guy drinks, and he even was drinking on the show when he was actually taping it that way. Then he does drugs like crazy. Then he takes prescription medications like crazy. And I'm sitting there going, I'm not joking. There's times I sat there and go, man, that guy just must have the best CYP3A4 pathway on the planet. He's still kicking. Do you understand? That's why I always use the example that some people can drink, smoke, eat bad, everything like that, and they still live to 100 years old. And there's people that take aspirin, and they can have a negative reaction and die from just one simple drug. See, it's all about, this is the coolest stuff. If you understand how cool the human body is. Now you say, Doc, and no joke, this woman reacted, that last lab that I showed you, reacted to chemotherapy. She couldn't even metabolize it. So body couldn't rid it. So of course it went higher even though they judged what she could probably handle, but because she couldn't metabolize it, taking something toxic, make it to water soluble that way, it almost killed her. Almost killed her. It's important. So do you know, have you been tested to see how that pathway has been metabolized? Because you're deficient. A simple aspirin, other medications can have very high negative side effects because you are deficient. You don't have the constituents to sufficiently give that pathway for you to even just rid medications. All right, here we go. Next one, let's go to the next key point, Brandon. I'm gonna get a little more intense now, guys, so if you're offended, it's time to back off. The CYP3A4 activity is absent in newborns, but reaches adult levels at around 1 year of age. Let's come back here. I am so frustrated that they give children medications when they don't even have the basic pathway to rid more than 50% of medications in there. It's why our infant mortality and morbidity stuff is so bad in the United States itself. It doesn't have the ability to get injected with a ton of things, hepatitis B and all these things that have toxic effects and medications that our body isn't even prepared to deal with. How can we justify, with the exception, let me say this, how can we justify medications for children under 1 year old unless it's a life-saving event? Somebody just tell me of how the liver works and how we even rid medications and how we rid vaccines and how we rid all these pathways and stuff like that when the body has basically no ability until they're 1 year old to remove this stuff properly, and you're telling me that it's okay to give a vaccine the day they're born, it's okay to jack them up with silver nitrate in their eyes, it's okay to do all these medications, and you are such liars because it's not even physiologically possible. Now, if your child's gonna die, do anything. But the concept that you're going to give this stuff and it's safe and effective and all these things are okay makes no sense if you just understand one pathway of the liver. Oh. Prove me wrong. I sit and talk. I have good friends that are pharmacists. I have good friends that are bad. And I say, tell me what you think. And they look and go, can't argue with you. I'm not looking for an argument. I'm looking for, we need change of not only thinking, but an aspect of clinical practice. Now, yes, if your child's gonna die, I don't care what you do to keep them alive. Give them every medication, even if they can't metabolize it. But this concept to give kids before they even have the proper ability for their own body to work and move this stuff out, really? Really? You're gonna sit there and tell me you're the expert and I just bring up one part of the body, how it works, one enzyme in the body, and you're sitting there like a deer in the headlight, look, don't know what to say. Told you, if you're highly offended. You know what happened? I know why my testosterone's going crazy today. So, just a commercial break. I gotta calm down. I gotta take a listen to my coffee too. All right, got ZV in my coffee. All right. One of my favorite actors. No joke, he's just a butt kicker, and he's bald too, so I think I like him. It's not Vin Diesel. I would love Vin Diesel, but Jason Statham, you know what I'm saying? He's played like in the Expendables. Good-looking stud, bald guy, kicking butt. He actually had a really good movie. I watched it the other night till like 11:30 at night, and I just couldn't sleep. And so of course he's just a butt kicker. It's just, I love it. He's just a stud walking around. He saves the hot girl and stuff like that, and I think it's just innate in a guy that way. You know, go kick the crap out of everybody, save the hot girl. Everybody makes out the end. It's just a good movie. So it's called, what was it called? It was some Mechanic Resurrected. It was kind of cool. I haven't seen the movie. It's really good. Anyways, I have no idea why I told you that, but it got me laughing, calm me down. All right. I have no idea why you guys watch this show. I must be doing something right. Okay. But so that's why testosterone's all jacked up watching the kind of movie like that. So, anyways, here we go. Let's go to the next point, Brandon. Key message, part number 3. The liver and small intestine have the highest CYP3A4 activity. It's true. It's why when you look at it this way, understand that when you see a deficiency in that, it's probably going to be some liver or intestine. And I did a little investigation because you're going to see one of the supplements. I'll show you how it does work. You're going to look at, they also has an activity in the brain too. You see some of that, the CYP is active in the brain too. There's really 3 major places. All right, let's look at the next point here. All right, here we go. Some important CYP 3A4 interactions are due to intestinal rather than hepatic enzymes inhibitors grapefruit. So come back. See, what they'll do a lot of times, you guys don't realize this, they'll say, oh, wait, if you take this medication, you can't have grapefruit. Let me show you why. Because, not yet, don't go back to this, Brandon, but I'm going to show you one of the inhibitors. So if you take this nutrient, it inhibits CYP3A4, and that's actually grapefruit. That's why you say, if you take this medication, don't take grapefruit, because this medication is part of that 50% can't get rid of, and obviously you take grapefruit with it, you can't rid it. Well, that's only true in the intestinal tract. In the liver, grapefruit doesn't have an effect on the liver. So that's why when you see these things like interactions, so let me give you this. So when you see this, I kind of find it funny. Well, doc, does this herb interfere with my medication? Do you think that there's like two people jousting inside your body? One's an herb and one's a medication, and they're fighting each other and interacting? That's not how it works. I just find it so funny. I'm like, what do you mean by interacting? And they have no clue. Well, my doctor said things like herbs can interact. Okay, what does it mean interact? Are they having a battle in there? Who can win? No. So let me go with this. Grapefruit is an inhibitor. It's almost like a medication to the pathway CYP3A4. That means it will make it go down. It'll take away some of the enzymes in the small intestine. So therefore, in the small intestine, if the medication was supposed to be rid, it's gonna have a little harder problem, but it doesn't do that in the liver. So understand that there's certain areas of the body that have these enzymes, and so you'll have a little harder time breaking down the medications in the small intestine or transfer in the small intestine, but you can do it in the large intestine and do it in the liver anyways. So, but it's true. That's why you see some of the things that inhibit it are medications and some nutrient things. All right, let's go to the next one. Now, wait. Here we go. I'm going to do two of them. Here we go. There is considerable variability in the CYP activity in the population. That's true. Different cultures have different levels of it. Some people metabolize things different than others. We know that. But here's the big one, and we're going to get a little emotional on this one. Women have higher CYP3A4 activity than men. Come back here. It's time to talk about this and get ready for some serious conversation and why people drive me absolutely nuts, and you are going to not only hurt the transgender community, you're going to set them up for cancers and other diseases, and doctors, you'll be responsible, but you won't be held accountable because our crazy medical system and our political system think this is okay. Let me give you an example. If you look at the basic levels of me, Brandon, Dr. Patrick sitting over here, and we're all guys, we have a certain level of estradiol. Now, if I believe that I was a woman, and guess what happens, and I want to take hormone therapy, do you understand that my liver, my small intestine, doesn't have the amount of activity to be able to handle those levels of estrogen? That means no matter what I do, no matter what I eat, no matter what I take, and things like that, I am not going to restore that pathway to such a high level that I can handle estrogens like a woman has. So, ladies, 1 out of 100 men today of all breast cancer are men. That means if I get levels of estradiol, 4-hydroxy, I could end up with breast cancer too. They're going to take these young boys and give them estrogens, and they're going to cause major problems. And doctors, I'm sorry, your first choice is do no harm. If you are a doctor that actually gives hormone therapy to young boys, to actually, just because they believe they're a girl, I'm not saying they don't believe they're a girl, but for you to give them actually hormone therapy and put levels of women so they can have characteristics like that, which they will, you are setting them up for cancers and other diseases, and you should be so ashamed of yourself. They should rip your license away. And for our Democrats in government saying that this is okay and this is standard and you got to accept this, no, I will never accept it, because you're causing harm and you're causing these young men to actually, and women, it's going to show you there, it's going to cause them to be very sick, and you will never be held responsible because you're trying to actually please a culture instead of what the human body really needs and what it can do. You should be ashamed of yourself. Any doctor that thinks of doing something like that should not only lose their license, culturally and publicly, they should be ashamed, and you guys should not stand for it. I will not. I will not. I will not let a young boy who thinks he's a girl, cool, you can think anything you want. You can. But to then force insurance companies, or actually like the HSS director said, we're going to give these young kids healthcare so they can do it, or the military, a guy wants to be a girl, sorry. do no harm. And we're doing this. The biology of your liver can't even handle that level of estrogen levels. Women have a lot higher levels because they're meant to metabolize and convert more. And heck, they have a problem. That's why breast cancer is so bad. Watch what happens to all these transgender boys. They're gonna make them so sick later in life, and they will never take responsibility, and they will never even correlate. But I'm telling you right now, I've said this since day one when all this transgender stuff goes on, you are going to hurt these young men. It doesn't matter if they're teens, 20s, 30s, 40s, 50s, anything that way. You are going to cause major health problems in there because their biology is not even meant to handle it. Prove me wrong. You can't. Because you can't tell me that women have a much higher level than men and it's not going to make a difference. Because I'll tell you right now, I've seen it happen. It's why people that take performance-enhancing steroids, especially women, they don't have the ability to handle testosterone like guys do. See, when you look at the basics of biology, and there's no argument. Every argument you have is cultural and emotional. You can't tell me about a child that can't metabolize a drug. You can't tell me the fact that women have more and now they're going to actually give this to guys and they're going to be able to handle this stuff. It doesn't work that way. It's really sad. And they're going to hurt this. And the same thing happens with women. You start giving them testosterone, they're not meant to handle those conversions. And it's going to aromatase, and it's going to end up with high estrogens, and they're going to give them more cancer. First, doctors, it's do no harm. So if your doctor says that's okay, I don't care if he loves Jesus or not, he is a pathetic individual because he's going to cause a lot of sickness and illness, and it's so sad. It drives me nuts. I watch doctors that, I'm sorry, just pick on, they actually say, no, it's okay, it's their choice. It's your choice to do no harm. And you know it's going to harm them. And I talk doctors this. I do. Like, here, prove me wrong. And what am I standing up for? Am I trying to be right? No, it's my job to stand in the gap to protect people from actually being hurt and not giving the full information. Now, watch this. When there's a risk, there should be a choice. Tell them, tell the transgender community, I'm setting you up for some problems. You want to choose to do it? It's on you. It's on you. And if they choose to do it, cool. They end up with cancer, don't feel bad for them. They die early, that's on their own. But the idea is this. A doctor should not tell you, and a doctor that gets on CNN or even Fox or any of these news stations or online saying, we need to feel something, we need to give this, we need to be paid for this. This shouldn't even be a debate. This should be, really? They can't handle it. They can't handle it. It's really frustrating watching what happens. And the activity is much higher in women because they have so much more estrogen levels and conversion metabolism they have to deal with that way. And it's scary. It's really scary. Because the sad part is this, we're going to see us right now. The transgender thing is a big topic right now. I don't know why. I don't care actually and some of that. But the idea is this. All these individuals are going to get sick and cancer and all these therapies that they do. Do you understand that they stopped, go back to the 2001 study we did a little bit ago. They stopped hormone replacement therapy. Oh, Brandon, come here. They stopped hormone replacement therapy on women back in 2001 because just hormone therapy in women was causing cancer. And now you're going to give levels to a guy and you're going to think it's good? Man, how can this stuff perpetuate? Sorry, I can't handle it. Next one, here we go. Next topic, here we go. Potent inhibitors of this include, look at this, certain antibiotics, certain medications, and also golden seal and grapefruit. The golden seal has the same kind of effect in the liver, but also in GI tract, not as much in the liver, but more in the GI. Inducers, which means stimulators of the CYP, including phenobarbital, other medications, including, and also St. John's and glucocorticosteroids. Think about this. If you think about this, if we take a look, it's why St. John's, actually, if you look at that woman over there, it's why St. John's is so contraindicated in medications. Because St. John's helps stimulate the pathway from on the CYP3A4 pathway. That means it will rid a bunch of your medications out of your system. So people say, I want a detox. You want a detox? You want to get medications out of your system? Flood your system with St. John's. But be careful, as you circulate that, you're going to have a whole bunch of stuff come out. That's why St. John's is probably one of the #1 contraindicated supplements herbs when it comes to every medication because it says, hey, here's the constituents you need to make this pathway phenomenal. We're going to stimulate it, and it just takes all the medications and pushes them out, pushes them out, pushes them out in the urine, pushes them out in the urine, pushes them out in the urine. So it's kind of funny. It also does that in the brain, okay? It actually helps convert your serotonin in the brain. That's why St. John's works in the brain. That's why St. John's has an effect on serotonin. It changes a sulfated form. See, basic anatomy, physiology, biochemistry that I geek out on. There is no interaction with St. John's in your medication. St. John's gives sufficiency. It restores. It'll bring back. So let's go back to this. Let's take a couple cases. Here we go. Now this is a little different. Here's a woman that was taking hormone therapy and ended up with breast cancer. Look at the estrone and estradiol, elevated. Look at the ones going down, elevated. But look at this. Look at the two ones that are normal. They both are the blue, if you look over to E3, but if you look at the blue one going down, oh, look at that, 3A4 pathway. The body actually was deficient in St. John's and couldn't move it to its weakest form, estriol. So you wonder why the hormone replacement therapy caused breast cancer in this woman. They even told her it did, is because she couldn't even convert it to its weakest form. Ladies, even if you were going to take medications, don't you think you should have normal, sufficient pathways to be able to handle it? Think about this. This hormone therapy gave a woman, which needs higher levels than a man, breast cancer. What do you think they're going to do to transgender males, and they're giving these levels high? And on top of it, they don't even have the right pathways sufficient to do it. Started to give this woman St. John's and other things, not just St. John's. Ran her lab again. Guess what happens? Estriol started pumping out like crazy. She's like, Doc, my urine even changed color? Yes, and that's why if you noticed, estriol is the highest hormone in urine. It is. But see, that should be fascinating to everybody. That should be like, oh my goodness, why is it the highest estrogen in urine? Because it's the weakest form to get out, and it's not going to cause any major problems. And it's kind of cool. And we start to see this go up, and I looked at this woman, no joke, and their skin started to get better. She's like, Doc, I'll just do it. Yes, because your estriol is going up, it's converting, and that's metabolizing out, and actually your skin, your hair, and she was just blown away because her body was actually starting to go back to normal. Did she go through other conventional treatments like chemotherapy and radiation? Yes. She did. It wasn't my job to tell her what to do. That's her decision. That's her choice. That's what I stand for. Choice, choice, choice. But regardless of what she chooses, it's my job. It's a Wellness Way practitioner. It's a Wellness Way doc. It's a Wellness Way office to give a different perspective that makes sure that those pathways are normal. So whatever you choose, including medications, including stuff like that can metabolize these things, convert water, so your reoccurrence is less. So all these things are less. So now you can sit back and go, I have a little less risk than if I listen to the conventional and them yelling about their perspective, and they're the experts. Here's another one. Now, once again, you can look at the graph. It starts to go see that ratio is going down. You start to see that 16 is low. You start to see estriol is in the normal range, but it definitely can be more. Once again, simple hormonal things. And what happened was this. This young lady was not a cancer person. This young lady actually had PMS. This was a teenager. And lo and behold, when I see that 3A4 pathway going down, if you really want to do your own research, you'll see that's very common to actually have depression with it. That's why St. John's works so well if that pathway is low. Now, if that pathway is normal, St. John's won't help your depression. St. John's won't help your metabolism because there's other pathways that contribute to those things besides the one. But it's a very common one. It's why St. John's even got known for depression. It's not really for depression. It's for the hormone metabolism of this enzyme, and now the constituents help induce it and move it through. There's better hormone balance, there's better change in the brain, there's better change in the small intestine where a bunch of endocrinopathin cells are, where serotonin is made, and all these things happen. You have more serotonin cells produced in your GI than you actually have in your brain, and therefore there's a fact that see the connection between all of them? Man, I love this stuff. It's the coolest stuff ever that you will not hear from anywhere but right here on a different perspective. And I'll tell you something that was really cool. I got a call from Andrew Wakefield, literally, I think it was Thursday, because they're producing another great movie, and they need a hormone fertility person on there. And they're sitting around like that, and Andrew's like, I gotta call Dr. Flynn. Because he's bold, he's controversial, but damn, his material's great. And so I was asked this past week to be in an upcoming movie on hormones and fertility and vaccines and stuff like that, just like his last movies, and from Vax to all the things have done wonderful out there. So I will be participating in it. I get interviewed, it's in combination with CHD TV with Robert F. Kennedy Jr. And now I was recently asked to be a part of all that. So I'm very honored. Thank you, Dr. Andrew Wakefield. Thank you, Robert F. Kennedy Jr. Thank you for CHD TV. Thank you guys that are putting the movie and stuff together. I think I get interviewed for the whole process on June 14th. I thank you. I stand here humbled. I stand thankful. I'm actually appreciate all you guys watching all of our material as I continue to share this stuff. I'm just trying to bring you guys such a different perspective so you can make your freedom of choice. I love the fact that there's information out there. As you show, I showed you some basic hormone stuff from 1975. How is it for 45 plus years that they all have it wrong? It's because they don't have the right perspective. They sit there, and I absolutely love this slide, and Brandon, we'll come back to it in a second, but I absolutely love this slide. They sit there and argue and yell at each other and say, I'm the expert, and I'm this, this, and this. And then you have somebody that comes along and is to put this slide up right here. They sit there and yell at each other. I basically think like the square is medicine and the circle is the natural field. Now I'm standing there going, guys, we're standing in a room with a cylinder with some lights coming in two different directions. It's all about perspective. And I sat back and said, we have more natural things, we have more medical things ever in history. And the rate of breast cancer, and the rate of all cancers, and the rate of diseases, and the rate of infertility and everything continue to go up, because no matter what you think, we can actually find another crazy berry in South Africa or Brazil, and then every natural company and multi-level company is going to jump on and tell you it's going to save the world, and people will be just as sick if the perspective doesn't change. So, good day. No, I take it back. It's not a good day. It's a great day. Thank you so much for watching Different Perspective. My name is Dr. Flynn. You guys go out, have a beautiful, wonderful day. I'm going to enjoy my coffee for a little bit with Brandon and Dr. Patrick on this wonderful table, because this table, I just love this table. It goes up and down. I just love this thing. These tables are amazing. I am entertained and I am appreciative of the simplest things. I mean, this thing is all, actually, do you guys know it's kind of cool? Watch this, it can go up, it can go down. I mean, it's just kind of cool. Thank you, Joshua. Thank you, Renee. Thank you for your team. Always give me the best stuff. Thank you, Brandon. Thank you, our amazing media team. And you guys just have a beautiful Saturday. God bless. Have a great Memorial. Thank you to all you veterans. I really appreciate you, because you had a different perspective that led for my freedom to be standing right here. God bless you. I love all you guys. Talk to you soon. Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.